Now, before we jump right into some of the latest research you and your group is doing on melanoma, maybe you can shed some light. Why is it that some patients have higher risk for developing melanoma, right? Especially if people with lots of freckles, red hair, and why is that?
So it clearly is the case that the biology of skin is contributing to the risk, but it is not the only component to it. There is an interaction between the skin, particularly the pigmentation in the skin, and the environment, where we are particularly focused on the role of ultraviolet radiation. And within the ultraviolet region of the spectrum, there are different components, and particularly UVB and UVA appear to be contributing to that risk. And we think there are interactions between melanins. Certain melanins can have protective effects. The dark pigments can actually have protective effects, whereas the light pigments, the red blonde pigments, actually seem to worsen the risk. They seem to induce a chemical injury in the skin, particularly in combination with certain
Before you
wavelengths.
go on a little bit further, maybe just to clarify, since we have a lot of general public out there, what is melanin? What is pigment? And what kind of cell makes it? And why what is those things?
Sure. So melanin pigment is the material that causes the pigmentation, the color that we see in our skin or in our hair. It's actually the same pigment in our hair that would be present in our skin. So given the wide variety of hair colors that you see out there on the street, that type of variety actually exists within our skin, but it is not as apparent, actually. The variety of skin pigmentation, while there's a wide range, it's not quite as wide as what we can see in the hair, because in the hair, it's much more concentrated than it is in the skin. It's more dilute. So for example, my skin is very light. My hair is very dark. My skin is probably pigmented quite similarly to the skin of a red-haired person,
No.
even though the pigment in my hair is not, primarily red or blonde at all. It's quite dark, and so the pigmentation components are actually nonetheless very important in controlling or regulating, modifying the risk of melanoma skin cancer, as well as non-melanoma forms, many the most common non-melanoma forms of skin cancer. And so that is a very important area that I would say, stepping back and looking, we would say it's an interaction between your genetics, what you're born with in terms of skin biology, including pigment, and what the environment is inflicting on your skin, part of which is determined by how you choose to expose yourself to that environment. One thing you did ask, I forgot to answer, is what kind of a chemical is pigment, melanin? It's not a protein or a lipid or a sugar. It's actually what we would call a small molecule. It's metabolized from an amino acid, which is a building block of proteins. It's the amino acid tyrosine, and it gets modified chemically, and then later on it actually does aggregate and form these large polymers that absorb light, and that's the reason that we perceive them as having color, because they absorb in certain wavelengths more than in other wavelengths. But that's a super quick summary of what melanin is, and its composition has a lot to do with what our risk is. People with dark pigmentation in their skin have dramatically lower risk of melanoma in the sun-exposed parts of their skin than people who have light skin. And also the ability to tan is a very important variable. People who don't tan or tan with great difficulty or burn very easily are at much higher risk of having melanoma in the sun-exposed parts of their skin. In the non-sun exposed parts of the skin, like your palms and soles, or inside of the mouth, or in the genital urinary areas, those forms of melanoma occur at approximately a similar rate in people with light or dark skin pigmentation.
I think I interrupted you before. We talked about melanin is this pigmentation that's produced by melanocytes, right? And you mentioned there you use some technical name eumelanin, which is representing the darker pigment, and the pheomelanin, that is the lighter pigment, right? And you were in the process of talking about when those melanin, the different type of melanin interacting with the UV radiation, something different biologically happened, right? And that causes one group to have higher risk. Maybe you can continue with that thread.
Sure, exactly. So actually, there were studies way back in the 1960s showing that red blonde pigments, the so-called pheomelanins, actually on their own have a chemical reactivity that produces what we call oxidative stress or
Yep.
reactive oxygen. This is the opposite of an antioxidant. Antioxidants we think are good in being protective. These are pro-oxidant. And even more so, if you shine UV radiation on the red blonde pigments, the light pigments, they emit even more pro-oxidant stress. In contrast to that, the brown black pigments actually are very potent antioxidants. And a component of their protection against sunlight is probably that protection against the oxidative risk that UV ultraviolet radiation is inflicting. They have some ability to actually absorb UV itself, like a sunblock, but it's surprisingly weak. It's not a very strong SPF. The SPF even of pure dark pigment is single digit SPF. It's not like these SPF 30, 50, 90, anything like that. So the protection against melanoma, the likelihood of getting melanoma from within sun exposed skin in people with darkly pigmented skin is hundreds fold lower. And so there is a benefit, we think, even from this antioxidant effect that is probably beneficial and protective against melanoma.